those of you that aren't familiar with occupational therapy, it's not something that I hear a lot of in the ancestral health circles, but essentially what my job is to help people overcome disease, disability, dysfunction, to really maximize their what's called occupations of daily living. So the things that are most important to them to do throughout the course of a day. And marrying that with some functional medicine and pediatrics, I think one of the most important things about today is going to be that mismatch of how we used to play and how we play now. Mismatch is kind of a word we've heard over and over again. So to start the idea of pretty much convincing you guys over the next 29 and a half minutes that proprioception really does contribute to self-regulation, I want to go through kind of a case study with you. Jasmine was a little girl that was referred to me for an evaluation, and she had been born to a drug-addicted mother and abandoned at birth. She had been at her 9 years of age through 6 different foster homes, so she really was bounced around. She definitely had some attachment issues. And when I interviewed her foster parents, her current foster parents were really intent on making sure that she got all of the supports that she needed. So I interviewed her foster parents and I interviewed her teachers, and these were some of the things that they said to me about Jasmine. They said that, specifically her foster parents who had another child said, "My son doesn't understand her. We have a really hard time with that family dynamic. She can't participate in family activities," meaning her states of regulation were so off that she really couldn't successfully participate in mealtime or playtime or family outings. Her teacher said, and this might sound kind of familiar to some of you and that have kids or have worked with kids, that she won't sit still, she doesn't interact with the other kids, she cries at the strangest thing. And this is usually a red flag for me. When there is cyclical emotions, lots of periods of intense anxiety or intense crying, that's often where I really get concerned and want to make sure that we give supports. The teachers also said one day she'll understand a lesson and the next day it's like she forgot. So inconsistency in her academic performance was a big deal. And then she doesn't play appropriately on the playground. And as much as I hate the word appropriately, because really, what does that mean? It was interesting to note that sometimes she would be really, really active and sometimes she would almost be in like a fetal position in the corner of the playground. So I had 30 minutes with Jasmine. And one of the things that I do when I first start working with kids is I will ask them to draw a self-portrait. And I think this is really telling. If we look at the first thing that she drew. So it's a 9-year-old little girl. And those of you that are familiar with child development might see that this is pretty atypical for a 9-year-old. 9 years old, we'd expect like 10 or 15 body parts, right? But what are some things that jump out at you in this portrait, this self-portrait? Anyone want to offer, what's one thing? Yeah?
It's got like 15 arms.
Yes, multiple appendages, for sure. What else?
It feels very chaotic.
That's a good word for it. Feels very chaotic. What else? What else do you see multiples of?
Lots of eyes.
Eyes, absolutely. Anything else? Noses, right? And finally? Yeah. Well, and that's what struck me. You said smiley face. Like, bless her heart. She is still drawing a smiley face, even though she is this precious little hot mess. And so when I kind of interpret that, what that says to me is all of the ways that she's taking in sensory information from her environment, she has multiples of. So she is taking in things at a rate and at a level that is really much different than what typical kids would. So we spent 30 minutes, and the 30 minutes was really child-directed play, and it was in a therapy gym, and she climbed, and she hung, and she crashed, and she rolled, and I really didn't have a ton of interaction with her, so I wouldn't say that it was therapeutic. It was more just kind of playful rapport building. And then I asked her at the end of this 30 minutes to draw another self-portrait, and that's what she drew. So how many eyes do we see? 2. How many noses do we see? 1. This is a kid that is actually centered and self-regulated. So when we compare the first drawing that Jasmine did about the way she was feeling and the second drawing 30 minutes later, and the only difference between drawing number 1 and drawing number 2 was 30 minutes of proprioceptive input. That's the power of proprioception. And I think of which kiddo, which state, she would actually do better at learning, at interacting, at socializing, and all those things that we know are the important roles of childhood, right? So Jasmine, in her roles, is a player, she's a student, she's a daughter, she's a friend, she's a sibling. So she has multiple roles, and in this first drawing, the way she was feeling, her roles weren't being meaningful. She wasn't meaningfully fulfilling those roles. So what's the plan? I want to define what self-regulation is, because I'm going to toss that term around a lot. We're going to define what proprioception is, and we're going to zoom out a little and look at it from more of a behavioral perspective. We're going to then make the correlation between proprioception and self-regulation. We're going to incorporate play, and then finally talk about the applications, the takeaway. So self-regulation, ultimately, if we look at this bottom definition, and one of the things throughout today's talk that I think is important is, as I'm discussing this from the lens of pediatrics, I think it's also important to think about it in terms of our adult lives and how we incorporate these things, function or dysfunction, into our daily activities. So Sean Coffin-Phillips said that self-regulation is a child's ability to gain control of bodily functions, manage powerful emotions, and maintain focus and attention. And that's kind of a simplistic definition, but one of my grad students actually I overheard saying, so it's basically a kid's ability to keep their shit together. I was like, yeah, that's kind of spot on. So basically that self-regulation piece, we learned in kindergarten, right, that we have those 5 senses. But I would argue, and it's really known now, that we have much more than that, and that the integration of the internal senses, and what are the internal senses? Proprioception, kinesthesia, or gut, all of that really contribute to self-regulation. The other thing I think that's important to note about self-regulation is there's a context-specific component to it. So if Jenna, if you're sitting here and someone accidentally next to you bends down to pick up their pen and brushes against your arm, right? Your response might be to look over, might be to kind of check out what's going on, but then you would probably pretty quickly redirect your attention, hopefully, back to the presentation. Now, if I put you in, let's say, a cave with are there lethal bats? We'll just say there's lethal bats, right? I don't know. I don't know if they're lethal bats, but for this purposes, and it's dark, and the same exact sensory information of something brushing against your arm happens, your response is going to be very different. So the context really determines the adaptive response. For kids with self-regulation issues, context doesn't matter. These are kiddos that will have really almost a fight or flight response, a sympathetic nervous system response to that tiny sensation or that tiny movement, independent of where they are in their context. It might not be socially appropriate, but it happens. So what does dysregulation look like? It's okay to laugh at this because this is my kid. I don't know, he's a pretty regulated kid overall, but for some reason, soccer pictures this year, he was hellspawn and seriously possessed by demons, and this is what I got. And I quickly won Mother of the Year with the soccer moms. But the reason that I put this picture up there is because really you can see in someone's face if they are dysregulated, right? So you can see the grimacing, you can see the anxiety, you can see the posture. And you think of situations where we feel dysregulated and what we look like. It's kind of that grimace that you might tense up a little bit. Watching elections, for example. My face is kind of doing one of those things. So there's definitely some dysregulation cues that we can look for. Just get all these up there. So in periods of dysregulation, adaptive responses, meaning my interaction with my environment, are atypical. They're not what you would normally consider appropriate. Also, one of the biggest components, and this is what we'll get to later on when we discuss the research, is that the sympathetic nervous system takes over. These kids and adults have a sympathetic nervous system response to input. And as a result, we need to give them things that drive down that sympathetic response and drive up the parasympathetic. One of the things I get asked a lot by parents, by teachers is, okay, this kid is doing X, Y, and Z. Is it a sensory issue, a dysregulation issue, or is he just being a brat, right? Is this really just a behavior thing? And that's something that's kind of delicate to tease out. I would always, I think, rather assume that it's sensory and provide all of the supports necessary before I start to modify behavior, right? So just a quick overview of those internal systems that I mentioned. There's really a spectrum here. So we have the proprioceptive system, which we'll define in a minute, basically the system that gives you the awareness of where your body is in space. We have the tactile system, which, as you know, is the sense of touch. And we have the vestibular system, which is essentially the sensation of movement. So kids and adults really fall somewhere on this spectrum. They can be hyper responsive, meaning they will avoid input from those 3 categories, or they can be hypo-responsive, meaning they seek input from those 3 categories. So you might see kids that when they sit in a chair, they crash into the chair. They don't delicately sit down. That is a sensory seeking behavior. We might see kids that avoid light touch. They're bothered by the tags in their shirts or the socks that roll up in their toes or in their shoes. That's a hyper-responsive kiddo. The vestibular system is a little tricky because most kids tend to be hyper-responsive, a little bit fearful of movement in dysregulation anyways. And I think, gosh, it must have been 6 or 7 years ago, one of the most poignant examples of this, I was evaluating a 6-month-old little boy at home, and his parents were there, and so it's, you know, a home evaluation, you get a really cool insight kind of into what's going on at home. And we were talking, and I was kind of watching the little one play, and the dad, when the mom left the room, kind of got tears in his eyes, and he said, "I don't think my baby likes me. I'm not bonding. Every time I pick him up, he cries." So, I was kind of at a loss for words and tried to help him through it, and then the little guy started crying, and Dad swooped him up and did one of these things. Very instinctual, right? Like, how do I calm this kid? But the movement was off the charts. And so it was just a simple tweak of touch. So we know that proprioception is kind of our 6th sense. And as the definition goes, it's the subconscious and conscious perception of muscle tone, joint position, and location in 3-dimensional space. And we know that it's closely connected with our tactile and vestibular system. So if we go back to this slide, when there's dysfunction in one, sometimes we can compensate with dysfunction or with function in the others. And usually, I would say 9 times out of 10, when there is dysfunction in either the tactile or the vestibular system, if we can give proprioceptive support, the issues get resolved. And there are many people in the room that could explain this at a much better level than I ever could, but it's important to note that we're talking about the same proprioception that's been well researched, right? We have 4 major ways that we get the input. We have muscle spindles, which respond to tension and stress. We have that Golgi tendon organ. We have receptors in our joints and ligaments, and we have pressure receptors in our skin. So there's a feedback mechanism there that is pretty familiar. And if we think of a kid like hanging from monkey bars, all of those, you can kind of get a sense, are certainly activated. So what does proprioceptive dysregulation look like? Ultimately, it's an ineffective or inefficient modulation of input. So things are coming in, and they're getting a little scrambled before things go out, essentially. This is what you will see oftentimes as somebody that appears to be clumsy, a clumsy kid. There might be some motor planning issues. They have difficulty with gradation of movement, meaning if this might be a kiddo that bears too hard on a crayon or marker or pencil, that they're always breaking things. This might be a kid that self-feeding is a hard skill to actually acquire because they don't have a good sense of how much force to use when feeding oneself. I put a picture of a little guy touching the wall because one of the things I often see in the school setting is kids that don't know where their bodies are in space will kind of touch the wall as they go to give more feedback to kind of self-regulate. We know that hypo-responsiveness is much more common, so on that left end of that arrow that we showed earlier. And we know that in these kids, they need more information in order to really respond to their environment. So they, like this little guy, in order to center himself in his chair, he's squeezing a book on his head because that's giving him the input that he needs. Do you know adults with any of these issues? Maybe? So we've defined self-regulation, we've defined proprioception. Now, how do we link the two? How does proprioception actually contribute to self-regulation? How do we get from that before and after picture that I showed you at the beginning? Any of you familiar with Temple Grandin? Yes. Yeah, she's a Colorado lady, right? So Temple Grandin, Dr. Temple Grandin, is a professor of animal science at Colorado State University. She is a researcher, a writer, a speaker, and a woman with autism. And she has written extensively about how it feels to be someone that is autistic. She now has several consulting businesses where she consults with livestock. She's developed chutes, she's developed slings to calm animals prior to slaughter. It's a really interesting thing. If you have a couple minutes to look her up, she's done some fascinating stuff, and her work has really transcended countries and concepts, and she's really been a huge movement in the ethical treatment of animals. And more specifically, when it comes to kids and self-regulation, she developed this first picture here, which basically looks like a torture chamber, but essentially she took a mattress and she took some wood and she had a self-propelled squeeze machine or a hug machine because she really feels that deep pressure and proprioceptive input is so calming. It allows people with autism to function and to do meaningful things and those adaptive responses. So this was kind of, the first picture is kind of like what was the gross initial one, and now they are commercially sold in therapy venues and in schools. And I go back and forth about whether I think it's really an appropriate mechanism. I think for kids that are just first starting to learn how to self-regulate, it can be pretty powerful. But ultimately, when it comes to self-regulation, we don't want it to be extrinsic, right? We don't want it to be given by the environment. We want kids to know how to seek it out naturally in their daily activities so they get the input they need. Interestingly, this squeeze machine in the top left, I ordered it for a school where I was consulting, and there was a woman that was one of the teacher's assistants, and she would always rush in the door in the morning after like 2 or 3 cigarettes in the back of the building because the kids, it was a pretty intense school where we had pretty violent kiddos. So she was anxious about her workday, and when we introduced the squeeze machine, I found her one morning kind of rolling herself through it. And so I went and talked to her, and she said, you know, since I've started doing this, I roll myself through this 2 or 3 times, and I don't smoke before I start work, which is kind of cool. So what does the research say, right? Like, how do we know that proprioceptive input is actually doing its thing? We know that deep pressure is calming. What's an example that you can think of where deep pressure is calming? Anybody? Massage, absolutely. Swaddling, 2 really, really big ones. How do we calm? So research tells us, which is interesting, that proprioceptive input in those 4 receptors that we talked about earlier actually increases parasympathetic activity and decreases sympathetic activity. So we know that neurophysiologically there is stuff happening. There's a reason why Jasmine had that second drawing. We also know that it decreases anxiety, heart rate, and blood pressure, and it improves performance. So those are pretty big deals, right? Like, proprioceptive input is powerful in that sense. And then what does this mean? I mentioned roles earlier. The role of player, the role of friend, the role of daughter. How does this affect kids' self-regulation and really fulfilling those roles of childhood? So what does it look like? We've talked about all this proprioceptive stuff. What does it actually look like in practice or in real life? This picture of a kid jumping, obviously the crashing, you can think about what kind of proprioceptive input that would afford. The swaddling, most definitely. Jumping, climbing, the monkey bars. And the picture on the left, the top left of, what do you think they're doing, those 4 people? Right, watching a horror movie, watching something scary. And really, if you're a horror movie person, or when you're in an amusement park, whatever, when you see the posture of folks that are trying to calm themselves down, it's kind of one of these things. They are literally giving themselves proprioceptive input kind of subconsciously, right? Think about what we do when we're really anxious or stressed. We give ourselves proprioceptive input, right? Think about what happens or what we say that where we carry our stress, right? In our traps, because we're constantly giving ourselves proprioceptive input to decrease that sympathetic response. So it's a daily thing. It happens in daily life. So how does this actually translate into therapy? I use that loosely, but how does it translate into improved fulfillment of roles? When I evaluate a kiddo, I really take this Venn diagram pretty seriously. So I look at the child or the adult, the task and the environment, and how each of those things contribute to that centerpiece, which is really function. So if we take the example of, let's say, just sitting and listening to a presentation and understanding it, right? The 3 circles, the task is listening, the environment is the room, and the child or the person is whatever's going on internally. So let's say that we have someone listening that's fidgety, can't quite focus, isn't fulfilling the role of student very well. We analyze those 3 things to kind of see where the dysfunction is. Is the room too hot or too cold? Is the chair uncomfortable? Is my voice too loud, too soft, too fast to understand? Ultimately, we really look at the child or the person in order to address where we can be supportive. So if we think of daily life activities, how is proprioception embedded? We mentioned that a little bit. An interesting study also was that chewing gum reduces cortisol. So we think of things that we do for our own senses of self-regulation, and we're actually doing them even something as simple as chewing gum. And obviously those things help us think, learn, socialize, and perform. So let's get to the play part, right? Let's get to this mismatch of why, many, many, many years ago, kids were probably better at the self-regulation piece. Our distant ancestors' play, obviously, and it goes without saying, I'm preaching to the choir, definitely didn't involve toys or things or electronics, right? So play, as we know, was really a model for imitating adults for their survival instincts, for their survival mechanisms. So they imitated the roles that the adults had. Play fighting improved fighting and hunting. Learning occurred through observation and play, and really a naturalistic interaction with the environment, not necessarily in the classrooms. Any of you do any of Daryl Edwards' play sessions? Yeah, is this like not spot on, right? So he could actually give a fantastic assessment of this, as I think he just did in the next room over. But if you have done one of those play sessions and you've gotten involved in those very body weight resistive activities, that's proprioception at its finest. That's the self-regulation piece. And today, obviously, play has tanked, right? Our kids are inside, they're not outside, they're really not interacting with their environment. They're not getting proprioceptive input because, quite frankly, they're just not moving. So, back to the plan. We defined self-regulation, we defined proprioception, we talked about how one supports the other, we looked at play, and then ultimately, why does this matter, right? So, proprioceptive input leads to self-regulation, which leads to successful roles in children, really, and adulthood. So from a therapeutic perspective, it's really easy to tell you how I can apply this in my kiddos with self-regulation disorders. But I would argue that this ultimately applies to all of our children, whether they have diagnosed disorders or not, as well as our meaningful roles as adults. There's lots of studies that talk about recess in schools and how that really affects kids' ability to learn. And one that was pretty powerful said that when they went from 1 to 4 recess sessions a day, just 15 minutes of free play, kids were learning better and less fidgety. And that's, like not super specific when it comes to statistical significance, but teachers certainly thought it was. There's therapeutic implications for ourselves as well. And one of the things that I often get asked is, okay, so if we have this kid that's 6 and really has self-regulation issues, and we're providing all this input and guidance, what happens when they're 20? Are they the ones banging into walls? Are they the ones seeking out the kind of high adrenaline things? I think ultimately what happens, and what I've seen happen, is that we tend to choose things that help develop our self-regulation. So think about how you feel after maybe a really good CrossFit workout, right? And there's definitely some exercise endorphin components, or after a really heavy lift, or after a really long swim, or after some martial arts, right? We're providing that input to ourselves, and yes, there's kind of that neurochemical post-exercise piece, but I would argue that proprioception also plays a role. So how do we get research that tells us that this is really a thing? How do we get research that says this is something we need to pay more attention to? It's really hard because the ethical considerations of stressing out a kid and then finding out if some swing or some jumping works is not obviously something that's realistic. So one of the things that they're using is research with dentists, because people tend to be really dysregulated at the dentist, right? So they're using things like massage, things like weighted blankets, and a little joint compression activity to see how the stress response changes. Interesting stuff. So we defined self-regulation. We talked about what proprioception is. We talked about the relationship between the two, and then the applications. So to end, I would just ask you that your own conclusion be, were our ancestors better behaved? Questions?
Hi, great talk. Do you have any thoughts on behavioral tics or fidgeting or so-called restless leg syndrome as attempts to provide proprioception to the self?
So what I have found, I can't quote research, but what I have found in my own clinical work is that proprioceptive input combined with vestibular input resets the neurological mechanisms temporarily. So I have 3 or 4 kiddos now with Tourette's that I'm working with, and a very specific combination of proprioception and vestibular input has made a huge difference on the immediate task of learning, not necessarily in the rest of the day. So when I work with folks who are challenged with those things, we kind of pick our battles. So when is that issue becoming a deterrent to you successfully completing a task or a role? And let's start there. It's a great question, and I think hopefully as we dig more into the proprioception and self-regulation piece with research, that will kind of come into the Destin as well. Yeah.
Thanks for your talk and your work. Have you, or has anybody found that the people giving like a hug or the massage or that they get a similar response of giving somebody that? Is my first question. My second one was, has anybody really looked hard at the roles that we're expecting people to fill and the way we're trying to get there rather than finding a better way to get to those roles?
So let
Does
me
that make
rephrase.
sense?
Yes, your
And there are
second
two questions, sorry.
Right, the first question
Thank
I can
you.
address, but I'm your second question, can you just
yes.
clarify?
Well, so when we talk about the roles that we want
Yes.
kids to become adapted to,
Yes.
so has anybody looked at the fact that perhaps the dysregulation comes in the fact that we're asking children to fulfill the wrong roles at the end?
Yeah.
So in other words, our
Yeah.
goal is misaligned with our ancestors' behaviors.
Right.
And that what we see as good behavior compared to what our ancestors saw as good behavior is very different because the end result of how we need them to behave is not the same.
Right.
So
That's a fantastic question. We put kids in boxes ultimately, right? Like you have to do this, this, and this, and your role as student, you have to listen, you have to follow directions, you have to keep your hands to yourself, you have to sit in your seat for 3 hours or whatever it is. So I absolutely think there is a mismatch between what our expectations are and what evolutionarily we are predestined to be comfortable with, right? So I definitely think that's a big issue. I don't know that there's research that looks at those two things, but I can certainly tell you that from clinical experience, absolutely. And so most of what therapy looks like and intervention looks like is very child-directed. It's very much the idea that this child will seek what they need, and I support him or her in doing that. To answer your first question, the hugger versus the huggy, can I even say that, right?
Sure.
We know, obviously, that like a good deep hug is very self-regulating because of those from someone you know. If it's not someone you know, it's a completely different issue.
That's
right?
a different thing.
That's a whole other sympathetic nervous system thing.
Not bad necessarily.
But I definitely think that if there is, let's just say, a combined hug, the proprioception goes both ways. There's certainly a social emotional piece of who's the initiator versus the huggy, but I don't know that there's research that says that
The energy transference going, right. I just wonder if that can
Right.
have a similar effect.
Yeah, it's a great question.
Thanks for your work.
Sure.
Great talk. I have a question about if you've looked into any research about applications that attempt to change the environment outside of a clinical setting to increase proprioceptive opportunities, because obviously everyone in this room could benefit from more proprioception, at least in a productive manner.
Yes, if we were all sitting on therapy balls, I could talk for 4 hours and you would be mesmerized because you would be so regulated. Absolutely, in classrooms specifically, because that's really the most controlled environment, and when we look at childhood, that's the most predictable role that kids play, is that student role. So that's been tweaked a lot. I've worked with teachers kind of all over the board that have integrated different aspects of proprioception in their classroom that's very child-directed. So one that I worked with in North Carolina, she has a classroom full of kiddos with autism, and she has stations, and you take a card, and she calls it the heavy workstations, but you take a card, I might go to this station and I'll take a card and it's 10 wall push-ups, and then I'll put my card back. Or if I'm feeling a little funky and I can't really focus on what's going on, I might go to this station and take a card and it's 5 deep squeezes, or somebody makes me into a burrito with blankets and provides deep pressure. So absolutely, and I think once we get out of the classrooms and we can take that application into other roles that kids play, it'll be even more powerful.
Have you heard of the Stand Up Kids initiative in in California, that they're basically just trying to get kids out of their chairs?
Yes, absolutely. I've heard of it. I'm not familiar with all of the intricacies of it, but the concept, absolutely, it's a great one.
Thank you.
Sure.
I'd like to say your presentation was phenomenal and probably worth the trip down just for this alone.
Oh.
I'm a chiropractor, and I would say proprioception is the most primary goal of my care in general. It's a very misunderstood profession, even by practitioners within it, treating back pain, headaches, whatever you have. But the spinal joints themselves and the tissues surrounding them supply about 400% more proprioceptive input to the brain, afferent neurology, than pretty much anywhere else in the body. And regardless of what technique chiropractic you use, the end goal is to restore motion to the joints that are not moving properly so that they can supply that when you actually move your body. Sedentary individual doesn't benefit quite as much. But I just wanted to make that mention about chiropractic care and the tie with proprioception. And again, I agree with 100% of what you said today. It's awesome.
It's a great perspective, and it really marries the two really well, right? So,
Definitely.
I mean, there probably are some fantastic partnerships that could come out of chiropractor and pediatric OTs, I think.
Absolutely, absolutely. Thank you very much.
Thank you.
Hi. Great presentation. I have two questions. The first is a lot of people foam roll before they work out, and given what you said about the parasympathetic dominance, I was wondering what you think about the idea that you shouldn't foam roll before your workout because of that. And then the other one is, and maybe it's kind of along the lines of what he was saying, but if you have massage or foam rolling or any of those techniques that relieve trigger points or other forms of muscular tension, do you think that part of that has to do with greater sort of self-awareness of the local, that's induced by the local proprioception input?
I knew, Chris, you would have a fantastic question that would leave me a little bit stumped. Thank you. The first one, foam rolling. I absolutely think that there's a component of that. In terms of foam rolling before or after a workout, so proprioception is not just self-regulation, it's awareness of your body in space. So if we're waking up those proprioceptors before a big workout, theoretically, we're going to have a better workout because our mind-muscle connection is going to be better, right? So I don't know that I necessarily have a huge opinion on the before or the after. I mean, from a releasing the fascia so you can get better, lengthen your muscles to work out, I can certainly see, but I don't necessarily know that there's a huge proprioceptive input other than just to wake yourself up before a workout. Remind me the second question.
The second question, well, so before your talk, I had always perceived of the effect of massage or foam rolling or whatever in relieving muscular tension as an effect of physically manipulating the tissues.
Right.
But after your talk, now I'm wondering, is there an effect of providing local proprioceptive input that allows the nervous system to have greater awareness of what those tissues should be doing?
That's a fantastic question. I would have to say my first response would be absolutely. It's not one that we would make a direct association between, so it's pretty creative that you went there. I think
Well, it's all because of you.
well, thank you. I would say that really most of the research that talks about sympathetic nervous system depression and parasympathetic upregulation to kind of calm the body has to do with the receptors in the joints, not necessarily in the muscle bellies. So when we think of foam rolling, that's really, unless you're doing some joint compression in combination with that, foam rolling itself would activate the proprioceptors that according to research, don't necessarily inform the sympathetic nervous system as much as the ones in the joints.
But let's take it out of foam rolling for a second. And so like I have a bunch of trigger points in my upper traps, and so someone comes along and sticks their finger in them and they know what they're doing, and then it dissolves.
Right.
Like what about that situation?
I think that's more of a musculoskeletal thing than a proprioceptive input
Okay.
thing, but that's just my little humble
Yeah.
opinion.
All right.
It would require some digging. It's a great question.
Thank you for your humble opinion. I appreciate it.
Sure.
Awesome talk. Thank you.
Thank you.
I'm curious about your perspective with where we're at in history. As great as monkey bars are and physio balls are, they're cheap imitations of climbing rocks and walking through creeks. And do you think we're beyond the point where we can have that conversation and kids need to get outside and touch green things and move spontaneously? And are people ready for that conversation? Can they handle that conversation? Are we zoo humans now? Is there movement supplements instead of a whole foods diet now?
It's a great question, and I think like any movement, it requires instigators and advocates and reinforcers, right? So many of the schools where I've consulted have natural play environments. They have the very contrived, spinny things and the jungle gyms and the ropes and the monkey bars, but they also incorporate some nature. And I think what's scary to me is that we have to teach kids now how to successfully interact with nature. It's not instinctive, it's not intuitive, it's intimidating, and it's easier to play with nature in Pokemon Go than it is to actually get out and climb a tree.
So do you think that's scalable? Can we get them to that point, or do you think that ship has sailed?
I would like to say that it's definitely scalable and we can get to that point. Where I think it begins is with elementary curriculum and making sure that recess is somehow incorporated with a naturalistic setting, if at all possible. There are so many liabilities in the schools with kids that are free to explore and kind of the provisions that are put on exploration because it's unsafe and you know, they need kids in their little box at school. But I think with the right initiatives and especially charter schools and therapeutic day schools. So I consult with a couple therapeutic day schools that are schools where, we okay on time? Okay. That are schools where kids that have been deemed too violent or too, unfortunately, mentally ill is the word that they use, for the public school system get shunted to us. So the public school system pays us a daily allotment to take care of these kiddos that really are unsafe in their academic environments. Those guys we do amazing things with in terms of we do field trips to the forest and hiking and waterfalls and I don't know what the correlation is between kiddos that have pretty severe behavior disorders and nature, but it's powerful. So even if we start at that level.
I would challenge the definitions of those. Oftentimes it's simply the context.
Absolutely.
You know, I would posture the degree to which people are functional in dysfunctional environments or the degree to which they're actually dysfunctional. So,
context, 100%.
yeah.
Couldn't agree
Thank you
more.
so much for your work.
Sure, good question.
So this actually ends up segueing quite well from what he just said, I think. And that is, my question for you is to offer an opinion about how much of this, let's say, sympathetic dominance is natural because we have stress in our environment, so the proprioception is beneficial and we seek it because it's just how the equation works and it's great for us, versus
Yes.
looking at the root cause, like all these functional practitioners are saying, well,
Yes.
this is too much sympathetic dominance because of these events in our lives, so we solve those so we don't need the proprioceptive input.
Right.
Like, how much is proprioceptive input part of healthy, functional life versus a way to address a symptom?
Yes, that's a powerful question. And quite honestly, with the last year and a half of my functional medicine training, that is exactly where all of these conversations have gone in my head. Like, what are the triggers and antecedents and mediators of what we are presenting with at birth as really inherent dysregulation? I absolutely think there's a huge correlation there, but I also think that it's about context and opportunity. So for example, from birth now we have the Back to Sleep campaign, right? So babies sleep on their backs. They do not get tummy time as early as they did before, so they don't have the proprioceptive input of pushing their bodies against gravity. We have seen, 10 years ago, the average crawling age used to be 4 to 6 months. It's now 6 to 8 because kids aren't hitting those proprioceptive input opportunities as early. So I think a lot of it has to do with environment and context and training. And when we look at function versus dysfunction, it becomes a very fuzzy line because, as you said, proprioception is really inherent in our movement and our daily patterns. So I think it's a great question and definitely something to be explored.
Thank you.
Thanks. We have 1 minute? Yeah. Okay, one more question.
Are you familiar with the research that shows that kids with neurobehavioral issues often suffer from sleep deprivation and misdiagnosed with ADD, and you take care of the sleep deprivation and all this goes away?
I can't quote authors, but I'm certainly familiar that research has proven that, yes.
Well, is like this child, what I'm suggesting is part of your intake, is ask, there's validated questions that you can ask the caregiver. Does a kid snore? Does a kid grind their teeth? Does a kid sleep with their mouth open? Does they move around a lot? Right. Those are all things that might be helpful in your work. I work a lot with PTs and OTs, and
perfect. Okay.
we do that together.
It's interesting you say that because definitely a sleep a question about sleep is something that is very common, especially with our younger kiddos. But the quality of sleep that you touched on, in terms of what are those physiological symptoms of lack of sleep, the restlessness, the grinding their teeth, those are things probably to be more explored because that really speaks to quality of sleep versus quantity. Great question. Looks like we're out of time. Thank you guys very much for your attention.